Hi, I'm Dr. Matt Sheehan, chiropractor at Medford Family Chiropractic Center in Medford, Oregon. And I am here today with my friend Angie Orr, who is a licensed massage therapist here in the Valley. And Angie's helping me to demonstrate a stretch that I use with a bunch of my patients. And it's very effective for rotating, for a rotational stretch for the upper back and the low back, and even a little bit into the pelvis. It's a well-known yoga move called thread the needle, and we'll just jump right in. So some caveats with this one. It's done on hands and knees or all fours, and the problem with that for some individuals is anybody who has issues with their wrists, extending the wrist, putting weight on them, or on the knees. It may be contraindicated for you. You could try using pillows under your hands, under your knees, or do it on your bed. It would also work on a bed. So I'll leave it up to you to decide if it's something that might work for you or not. Okay, so Angie has not done this herself, which is good because we can show how to do it and ways that are not optimum, and Angie may come up with some good questions for me to answer that you yourself might encounter. So, okay, so we're going to start out on all fours, Angie. And so what you want to do is you want to I'm going to have you take your left hand, Angie, and bring it behind your head.
How far back?
Like this. I'll show you. There you go, just like that. Perfect. Good. And now what you're going to do, very slowly, very gently, you're going to bring this elbow up towards the ceiling, and that's right. You're going to rotate all through your torso, and you're just looking for the start of a stretch. And at the point where you feel the start of a stretch, if you feel pain, you're going to back it off till the pain goes away. And you hold it at the point where you feel the start of a stretch, and you hold it for 10 seconds. Slowly counting, 1,000, 2, 1,000, up to 10. And at any point, if you start to develop some pain, you're going to just back that stretch off a little bit. Okay, and when you get to 10, then you're going to drop this arm, and the thread the needle part comes in where you take that left hand and you bring it between, in this hole, so to speak, formed between the right arm and the right leg. So you got this spot here, and you're going to allow that shoulder slowly to drop, and you're going to keep the support elbow straight, and this arm, left arm, is just going to slowly work its way across the floor. But what you're mostly paying attention to is what's happening here in terms of the stretch. You're really looking for just the start of a stretch. Don't do what many of us do, especially with quote-unquote healthy muscles, which is to stretch, stretch it a lot, thinking you're going to get a lot more bang for your buck by pushing it. You don't want to do that in an area that's strained or been uncomfortable and super tight lately. If that's what you're in for, take it easy, be gentle with yourself, and as you find the point where you're feeling the start of a stretch, you're going to hold it there, and you can hold this for up to a minute. And as it relaxes a little bit, you feel the stretch starting to go away, you'll slowly inch your hand across until that stretch comes back. You'll probably do that several times over the course of a full minute. All right? And as the arm goes further across, you'll also feel it starting to stretch further down the back, into the low back and in the top of the pelvis. All right? So when you get to a minute, you can slowly back it off, and then switch directions and bring the right hand behind the head, slowly bring it up into rotation till you feel the start of... With this part, you're more likely to feel more of these muscles really starting to work as opposed to a real stretch. You may feel stretch in the front chest muscles, front of the shoulder here, but mostly the muscles here are going to start working. So I forgot to mention before that's something to be careful of also. If you do it too fast and you push too hard, you could strain or spasm these muscles while you're doing it, which you don't need to add a new injury to your issues. So again, you hold it there for about 10 seconds, and then you'll drop the arm and slowly slide it across, just feeling all this shoulder dropping and feel the stretch in through here. So again, you hold that for about a minute. And the next level of this, when this really starts to release and you're stretching all the way down, but you're feeling less and less stretch as the muscles get looser over time, meaning a period of week or 2 weeks, 3 weeks, then what you can do is you can graduate to the next level where you bend your elbow on the support side. So her left arm would bend. She comes down on her forearm here, and you'll notice her head just naturally drops onto her forearm as she brings that arm across. And as you do that, as you bring the shoulder right down pretty much onto the floor almost, is you're going to just get a greater stretch all throughout the upper back and the low back and even into the top of the pelvis. So you can experiment with that as well. Best way, thanks Angie, best way to do these with a stretch is, if you have the luxury of time, if you're recovering from an injury, twice a day. Once in the morning, once in the evening. Once a day is okay too, but if you have time to do it twice a day, generally that's going to be more helpful and you'll recover a little quicker. The least effective way to do stretches when you're recovering from an injury is to allow the pain and discomfort to remind you that it's time to do the stretch. It's too erratic. Best to set yourself up on a schedule and try and stick with it. There we go. Thanks.